Is this our dream come true? This endless buffet of luscious food? Or do we really want the perfectly balanced plate? We want the right food at the right time at the right price. And genetic testing and personalized medicine is the same way. It's like a buffet where we have this endless choice. But we really want the right intervention at the right time at the right price. But there are three issues preventing the movement of personalized medicine into clinical care: reimbursement, reimbursement, and reimbursement. On the one hand, we have the developers saying to the payers, I have a great new technology, why don't you cover it? But then we have the payers saying to the developers, I need evidence of medical necessity, so why don't you provide it? And what happens is confusion, ad hoc decisions, and inconsistent reimbursement. So what do we need? We need data. To the rescue, our center at the University of California, San Francisco, the Center for Translational and Policy Research on Personalized Medicine. We have a new resource that includes payer coverage policies. It's the only systematic, objective, NIH-funded registry. It includes what is covered and not covered by payers. It was developed by a team effort. Coverage policies are important. They are the published policies that payers use to determine what can be covered. But what we don't have is a systematic registry of what is covered. And we don't understand why payers make the decisions they do about what they will cover. So what is being covered in the area of personalized medicine? If you've never read a coverage policy, they can be pretty hard to read. This is just one policy by Aetna. It's 130 pages on genetic testing. So what have we found? There's limited coverage of panels that include the BRCA gene, even though the BRCA gene by itself is covered by payers. There's little coverage of these new panels that we have: whole exome sequencing, whole genome sequencing, pharmacogenomic panels. But there is a big success. Non-invasive prenatal screening has been a big hit, widely adopted, and payers are covering it. And in general, we're finding that there's consistency in the type of evidence that's covered, but less consistency in what is covered by payers. Why are payers covering or not covering new technologies? Straight from the horse's mouth, we talk to payers, have been doing so via our VRPair Board since 2007. These are senior executives from the 8 largest private health plans, leading regional plans, and thought leaders. What have we found? Payers are concerned that these new tests do not fit their framework of medical necessity, which is how they make coverage decisions. There's a concern about how we're blurring research and clinical care, and concern about whether patients understand these new technologies and what they mean. They want better targeting of these new tests. So we can have it all. Personalized medicine is here to stay, but it's just like a buffet where we're going to have to make choices based on weighing the benefits and the cost. And better information can help us make better choices. So we can be like this happy camper here who has the right food at the right time at the right price. Thank you.